Kinesiology 760, this is static posture assessment. Our test subject today is an 11-year-old competitive swimmer who also happens to be my daughter, Katie. This is anterior view. We'll start at feet and ankles. Feet should be straight and parallel, pointed forward, not externally rotated or flattened. We see here that the feet are only slightly externally rotated, which is good. Moving up to the knees. Can you lift your skirt up just a little bit? Just a little bit. Thank you. Knees should be in line with the toes and not abducted or adducted. Her knees appear to be centered between her first toe and her second and third toe on both legs. There is some scar tissue from a previous illness on her right knee, which we discovered in her PAR-Q. However, this does not appear to be presenting any static problems. Lumbopelvic hip complex. Pelvises should be level with both anterior superior iliac spines in the same transverse plane. Shoulders should be level. They're not elevated or rounded. Can you have hands at your side, please? Head should be in a neutral position and not tilted. Okay, now turn to the side, please. Lateral view, foot and ankle. Neutral position, legs should be vertical at a right angle to the sole of the foot, which it appears so. Knees should be in neutral position. They're not flexed or hyperextended. The lumbopelvic hip complex should be a normal curve, not excessively rounded. We do see some rounding of the shoulders, but not enough to be called upper cross syndrome, and given that she is a competitive swimmer, this is not unusual. Head is in a neutral position, not excessively leaning forward. Now can you turn around and face the refrigerator, please? Itch, please. Face. My daughter's itchy. Posterior view, feet and ankles. Heels are straight, not parallel, and not overly rotated. We see a little bit of rotation on the left foot. Knees are in a neutral position, not abducted or adducted. The lumbopelvic hip complex. Pelvis is level with the posterior superior iliac spines in the same transverse plane. Shoulders and scapula are level, are not elevated or protracted. And the head is in a neutral position and not excessively tilted to either direction.